Mariam Nanyonga is a mother. Her second pregnancy seemed normal until she visited a health center in Wakiso town for her antenatal and she found out that she was carrying multiple babies.
I went for a scan at 2 months because I realized my stomach was unusually big.
She was referred to Mulago Women and Neonatal Specialized Hospital for management as she required special care.
I have been here for 2 months now. The doctors said the babies are okay.
Her babies were born prematurely at 32 weeks and they are now receiving care including supervision by qualified health workers and most importantly, breast milk.
I do kangaroo for all the 5, but I give more time to this one of 0.9 kilograms. That's how I alternate them.
Many a time, mothers to these little beings are unable to produce enough or any breast milk. The hospital has been relying on donors. Today, however, the facility intends to find a lasting solution towards availing safe breast milk to their neonates.
We do have a 5-year plan, and the estimated cost to be able to make sure that we have the necessary equipment and all the different supplies that we'll be needing. For example, we'll be testing the women who will be donors to see if they are fit or their milk is fit, is free from infections that could pass on. That is at a cost of around 1 billion. 1 billion over the next 5-year period.
This investment will be vital for the up to 80 babies born prematurely at the hospital every month.
First will be those that are in hospital that have excess milk, more than their babies need. But over time, as the community gets more aware, we may need to bring in other donors as well.
The facility charges 1 million shillings per week of admission in the neonatal intensive care unit. However, only 25% of parents and caretakers can raise the money.
People are paying 3 to 5 million in the private sector. So if here you are paying 1 million per week, because also we need to support the hospital. Because we don't want to come tomorrow and the machines have collapsed. We don't want to come there tomorrow and it is a ghost unit. And then you say, but this government.
According to the Director General of Health Services at the Ministry of Health, Dr. Henry Mwewesa, they are finalizing the guidelines that will enable the facility conduct the donation and storage of breast milk.
What is expected, the donation, the screening for the donors, emphasizing that it must be free, like we do for the blood donation.
For partners like Atta Breast Milk Community, this is a move in the right direction for the hospital.
We've serviced over 600 babies. We've given out over 900 liters of breast milk. When these babies are discharged, most of them, they are discharged when they're still underweight, 1.2. They still need support. And the hospital will only service the babies in the hospital. We reach the community. The community has more babies who need these services.
In Uganda, 226,000 babies are born prematurely every year. They can survive under critical care at the level of a neonatal intensive care unit. Walter Mwesije, NTV.